Okay, in the last video we talked about fractures. In this video, this is going to be extremities. So we're going to talk about extremity injuries. And this is chapter 15, if you've got your book. Again, I'm not going to cover everything. There is a lot of information in this one as well. We're going to be talking about bone, joint, and muscle injuries, just like in the last chapter, but this is more specific to the extremities. So out to the limbs, fingers, digits, not talking about damage to the core. So there's some stuff that I left out in the last one that this chapter also covers, and I want to go over it just because I left it out in the last chapter, and we'll have a little bit more time in this one. Look for signs of dislocation. So the first thing we want to do when we're examining somebody is look for signs of dislocation. Oops, let me undo that because that is really hard to read. Dislocation. That's not much better, but it'll work. So we're looking for signs of dislocation, and we're going to use another one of these awesome acronyms that sometimes they have so many acronyms it just makes it confusing, but I'll at least go over and explain what it means. The D is for deformity. So you're looking for deformity, open wounds so that you can treat them. Looking for tenderness at the site. And you're also looking for swelling. So that's what the acronym DOTS stands for. So when you're looking for some sort of extremity injury, this is everything that you would cover: deformity, open wounds, tenderness, swelling. Same thing that we saw in the last chapter. But I don't know if I actually explained what DOTS was. I think I just kind of skimmed over it, assuming that you had already read it in the chapter, but just in case you don't know what it means, that's what it means. So thirdly, while we're looking for deformity, you want to use the rule of thirds. What this is going to do for you, let me draw this out real quick. So we have some long bones here. So let's just say that's the femur and the tibia. I've used this example before when I was talking about a joint and joint capsule. What we want to do is kind of break this bone up into thirds. So there's our tibia, there's our femur. And so when we're analyzing, when we're using the DOTS test, trying to find signs of dislocation or injury, we're going and physically touching the bone and softly kind of looking for tenderness and swelling. And if we find tenderness, swelling near the last third or closest to the joint, we're going to assume that there's a joint injury. So if it's the upper or lower third nearest the joint, say I've broken this up into, there's the first three parts. If it's near the upper half, or the upper third or the lower third, we're going to assume some sort of joint injury, that the joint is also injured. Not saying that you couldn't have damage to the bone, could be a fracture, but we're going to assume that there's a joint injury with it being that close to a joint. So let me scroll down here. We also want to consider the cause of injury. So you're going through this cause of injury, another acronym your book uses. So you want to consider the cause of injury, and that can tell you a lot about what's going on. So you also want to check how many acronyms is this. 2, this make 3. CSM, circulation, sensation, and movement. We talked about this, I'm pretty sure, in the last one. And that's always important when you're dealing with extremity injuries, dealing with bone, muscle, and joint injuries. So let's scroll over here so I have a little bit more room. Okay, let's talk about different injuries that you may see with extremity injuries. You've got contusions, which is bruising, so like some sort of blunt force trauma. Strains, I know we talked about this in the last chapter, so I'm just going to briefly touch on it. Like torn muscle fibers, and there's different levels there, different grades, different degrees, I should say. That's really how they classify it. Sprains to a joint, so we've gone past its range of motion. We have tendinitis, which we didn't talk about last time, which is just inflammation of the tendon, just like it sounds. Inflammation of tendon. This is more of an overuse injury, and it typically won't get better unless you let the joint rest. You have dislocation, and last time we talked about that, and that's just the bones getting displaced from their normal alignment. Kind of popping out. So the normal joint alignment, I should be more specific there. So joints keeping them aligned with the ligaments in the joint capsule. And then a fracture would be a break. Okay. And the care for all of these, and I know your book gets really specific, so if you read through your book, it's going to go into like toenail injuries, and it goes way out to the extremities, like breaking fingers. And but the care is essentially pretty simple. RICE, unless you have some sort of open wound. But for most of these, especially like dislocations, tendinitis, sprains, strains, contusions. Now fractures can be a little different. There's more care involved, and we talked about that in the last chapter. But right now with the RICE principle, I'm talking about dislocations, tendinitis, sprains, contusions, all that good stuff. You're going to use the RICE principle. So rest. Just don't use, let the joint or injured area rest, so don't do anything using that joint. ICE, the rest period is going to vary, just depending on the injury, the type of injury. I mean, a simple bruise, you may not have to rest it as long, whereas a sprained ankle, maybe a couple weeks, couple months, just depending on how severe the sprain is. Anyway, ICE, about 20 minutes after the initial injury. Compression, help alleviate swelling. And again, it depends on the type of injury. Elevation, improve circulation, keep fluid from building up. So there is how to care for the majority of them, not all of them. Now, one thing I left out in the last chapter that I want to talk about because it applies to this chapter as well, but if you're looking for more information about it, you'll actually find this in chapter 14, are different types of fractures. So we talked about fractures here, so I think it's a perfect place to put it since I have a little bit of time here. We have green stick fractures, which would be, let me draw this out. It'd be good to have a good visual of this, where we have, it's an incomplete break. It's not broken all the way through. So it's incomplete. Hasn't completely shattered, so incomplete. And then we have a transverse. Draw that out real quick. So it's broken, but it's cut completely across the bone, so this makes like a little right angle here. So we got a 90-degree angle right here. So that would be transverse, makes a 90-degree angle with the break. You have spiral. A lot of times these aren't spiral fractures. You can still typically put weight on the bone or use them, and because they're not broken all the way through, kind of makes a spring-like design where you have these spiral fractures running through the bone. It's normally caused by a twisting. Oops, I didn't label this one. It's going to be our transverse 90-degree angle. So we got the spiral twisting. Got oblique, which is like a slanting type of break. So we've got our bone here and kind of slants across for the oblique. Got the commuted. That's more of like crushed. Draw that out for you. So it's a completely crushing break. Really hard to get the bones set because it's done so much damage to this bone in between that it's really hard to get it to heal. A lot of times you have bone grafting involved. This is more of like a crushing injury. Somebody maybe had a lot of weight dropped on them, or a car crash where the limbs get crushed. That can be problematic to get it to heal. Then you have impacted. So these can be jammed together. They can function. This also you sometimes see in car crashes. The ends get jammed together. This happens sometimes in falls. You see rock climbers with these types where the ends get jammed together and they're essentially still functional when it comes to weight bearing, because it's not, the limb doesn't flop around, or it's not deformed like you would see in some other breaks like oblique and like transverse. You're definitely going to see some deformity there. And same thing goes for green stick. Sometimes it depends on how incomplete the break is. If there's a large enough bone, sometimes it's tough to see the break, and you really have to feel around to notice this big indention here. And often when these heal up, when the osteoblasts put down more bone, you get this thick knot here where the bone's even thicker than it was once it heals on its own, and the osteoblasts put down a lot more bone than usual.